Hey, I'm Trichodrama, and today we're talking about TRT, testosterone replacement therapy, and issues with the heart. So this was actually a subject that was kind of near and dear to me when I first started on TRT. And as a matter of fact, I started on TRT and then I remembered this. But early in my career, I carried a patient to an emergency room, and a doctor told me that testosterone and weightlifting could cause your heart to enlarge. And so after having already started on it for a little bit, I remembered that conversation, and then I really wanted to look into this. So basically, when people are talking about issues with the heart and TRT, what they're referring to is a condition called cardiomegaly. Cardiomegaly is enlargement of the heart. That's what it is. When you go back and you watch some of the stuff about older bodybuilders or athletes who died and then they did an autopsy and they had an enlargement of the heart, those kind of things. So cardiomegaly can be part of a disease process. You can actually have infections in the heart that cause your heart to grow. It can be from profound anemia, so colorectal diseases, colitis, untreated profound long-term ulcers that are causing you to be low red blood cell counts can cause enlargement of the heart. An excess of iron for prolonged periods of time can cause you to have enlargement of the heart, and bad valves, which again is part of the disease process. But getting outside of the disease process part of enlargement for the heart, one of the principal reasons you can have an enlarged heart is profound, prolonged, untreated hypertension. Okay, so one of the things you have to understand about the heart, the anatomy of the heart, is the heart's made up of four major chambers. Your top two chambers are atria, your bottom two chambers are ventricle. All right, so the right atria has pretty easy job. It just pumps blood down to that right ventricle, right? The right ventricle, now it's got to push blood all the way through the lungs and pass the lungs back into that left atria. That left atria has a pretty easy job again. It just pops that blood down in the left ventricle. Now the left ventricle though has a huge job. It's got to pump that blood all the way from the heart all the way down to your big toe and push it all the way back up and dump it back in that right atrium, right? So that left ventricle has a tremendous amount of work it has to do. And if you have systemic hypertension, if your arteries and your veins are constricted and your heart has to push against that force for prolonged periods of time, it can actually cause you to work that muscle to the point that muscle thickens, it grows, that left ventricle grows, and what they refer to that is LVH, left ventricular hypertrophy. Now the reason I'd had this conversation with this doctor about testosterone and weightlifting can cause enlargement of the heart is I took a 38-year-old female to the hospital who had a really weird EKG. And most of the time, if you look on like these medical shows and you see these EKGs and there's this like little upside down V and then a really big, peaky V going on there, that is called an action potential. That's a waveform, an EKG waveform. And that's potentially what the heart's doing. It's not always what the heart's doing, but it's potentially. But this woman, when I put her on an EKG, she had no V's. Her spikes were just straight up, narrow as you could be, right? So I get her to the hospital and the doctor's like, yeah, generally this is from one of two reasons. It's either from prolonged abuse of cocaine or steroid use and weightlifting, right? Causes the left ventricle of the heart to thicken, to grow. So consequently, she did admit to a prolonged abuse of cocaine part of that. And so, I reference back to that conversation when I started taking testosterone and started going to the gym. So then I had to look into it some more, and I actually spoke to my urologist about it. My urologist said, no. He said, here's the deal, is when you're talking about that, steroids, he said, steroids, not testosterone, steroids, and LVH, what you're talking about is people who are taking steroids from an illicit source who then are not under the care of a physician. They have hypertension. That hypertension is prolonged. They're having it, it's really profound, really high blood pressure for long periods of time. Because again, these are guys who are buying the steroids they're getting from dealers. They're not seeing a physician. They're not getting labs done. They don't have EKGs done. They're not getting any of the testing done. So they're running around hypertensive. They may not even know it, and their body's fighting against that hypertension. That left ventricle has to thicken up so it's stronger, so it pumps the blood against all that force of the hypertension throughout the body. Now, you know, there's absolutely no correlation whatsoever in just taking testosterone and thickening of the heart, okay? If that was the case, every man out there who had a high range of testosterone would be experiencing LVH, all right? So testosterone replacement therapy, putting your testosterone within normal limits, is not going to cause you to have left ventricular hypertrophy. If you're going to a credible physician and you're getting treatment for TRT, they would also be monitoring you for hypertension. And that same physician, if you were hypertensive, especially like if you're going to a urologist like I do, because a urologist is really going to try to protect you against hypertension, because hypertension in itself is damaging to the kidneys, and that's kind of their deal, you know. So taking TRT, being under the care of a physician, being medically monitored, having your blood pressure taken, having EKGs done. I don't get EKGs through my urologist because I get them annually for my physical for the fire service, and I just have my entire physical packet sent to his office so he gets to look at all that, so he doesn't redo any of that. But being medically monitored and taking testosterone will not cause you to have left ventricular hypertrophy, all right? Prolonged hypertension, untreated, is going to cause hypertrophy in most people who get it, okay? So barring disease process, all right? So you're safe. Be medically monitored. Do it the right way. Go to a credible physician. As I keep saying, you're trying to achieve the most you can with the lowest dose you can. Go to a guy who's conservative, who's gonna, you know, put you where you need to be, not necessarily where you want to be. I've discussed that previously, but you know, my blood pressure runs really, that's like 110/60 on average, and my physician's happy with that. My EKG waveforms all look natural whenever I get my annual physical done. You know, I give blood every 60 days. I feel like it does two things. Well, it does three things for me. It can save a life, all right? You know, keeps hypertension at bay and gets rid of blood cells, so I lower my hematocrit, you know. I do cardio. It's not my favorite thing to do, but I do cardio, you know, because you want to have a healthy heart. This is about reaping the benefits of all the things you've done throughout your life, so that in your later years of life, you're healthy and you can, you know, reap the benefits of all those things. And then lastly, guys, if you know, if you're going to a credible physician and you have hypertension and you run the risk of LVH, that physician can also treat you for that hypertension. So cardiac issues and TRT should not be a concern if you're going about it the right way through a credible physician and being medically monitored. And that's really the end of it, right? So, Trigger Trauma, I hope you guys have a good week.